I actually have a very interesting story about racism in nursing that I think could blow your mind. So obviously, I'm black, and we all know that there are not a lot of black nurses, for one, let alone black ICU nurses. I'm typically the only one on night shift, usually. Here in California, it's better, because I used to be in Wisconsin, but that's just how it is. And sure, you have your racist patients that are very confused and delirious and that will yell out slurs, whatever. I'm not talking about that. Okay, so this was back in Wisconsin, and I was working with a nurse. She was very nice, very helpful, very smart, very kind. And this nice nurse was giving a bed bath with our tech, and the tech was black as well. And this nurse, she asked the tech, she's like, hey, I didn't grow up around black people, so I never really got a chance to ask this question. But do black people wash their hands, or do they just grease them up? When I hear this, first thing I do is laugh, because that is the most ridiculous thing I ever heard. And then I got pissed, because that means you think that me, a black ICU nurse, does not wash your hands, which is putting my patients at an infection risk. Now you're insulting me personally. That was talked to with management, they handled it, whatever. Fast forward a week later, I'm taking care of a patient. She has DKA, little black lady, and we're in morning huddle getting like the rundown on all of the patients with all the nurses in the morning. And she goes, man, I hate taking care of DKA patients. They're always little black ladies who steal stuff. So then I go up to my manager. I'm like, look, this is the second time I heard her say some racist ass shit. You guys have got to do something. This is unacceptable. Management handled it. But shout out to the tech, because she called HR anonymously and was like, hey, this is what this nurse has been saying. The management team is aware, but I think this needs to be escalated. And she was fired less than a week later. But here's the bigger problem. She was fired. She's in NP school, and then she went to work at a different hospital in the area, maybe 15 minutes away. And the hospital that she's working at now, or was working at, it's a lower income hospital. If you know, you know. But the fact that she is now taking care of a majority of black and brown people is scary. And she actually got that job as a travel assignment, making double what she was making. And that just goes to show you, if you're racist in America, you can get away with anything. Nobody gives a fuck.